To undergo weight loss surgery, it is a journey, a transformation, and at times it may be very trying. At the end of the trip, I want that person to experience a positive outcome, both physically and also personally. And at the end of the day, that's why we're here, to make sure that happens to each individual who undergoes this transformation. In many ways, by the time people have come to me for help, it's really the last resort they're looking at. They have tried various diet programs and medications, and unfortunately, most programs will not work. And in particular, when they suffer medical illnesses such as diabetes and heart disease, it's the only known cure to render these conditions fully cured. And weight loss surgery brings about a cure for diabetes, decreased risk of stroke and heart attacks. And that's why people choose weight loss surgery. In many ways, bariatric surgery has chosen me. Initially, when I started training for advanced laparoscopic surgery, it was for stomach and bowel operations, which is a very similar technique to the gastric bypasses we're doing today. Back then, there were no formal training programs for gastric bypass operations. And in many ways, I was lucky to be at the right time and at the right place, because it provided me the opportunity to perform the first laparoscopic gastric bypass here in the state of Colorado. And also, I was one of the first to put in lap bands here in Colorado as well. So I've been very fortunate to be in that position. We run monthly free seminars here at Skyridge to provide education to people out there who are trying to decide whether surgery is right for them, and if so, what type of operation. I think one of the advantages we have is a very successful monthly support group that is run by a dietitian. This group consists of people who already had the operation done, whether it's bypass, sleeve, or banding. And I welcome people trying to decide the surgery to attend these meetings and to actually talk to the people that have already gone before them and tread the same path that they're about to lead as well. And these patients who already had the operations are more than willing to share their experiences, both positive and sometimes negative. And I think our patients' response that who already had the operation speak for themselves. And we had a lot of feedbacks where our patients who chose the surgery and our program have based their decision on these support groups. I'm personally committed in having our patients experience a fantastic outcome. For example, every single patient of mine gets my personal cell phone so that I'm a phone call away 24 hours a day, 7 days a week. That's how much I believe in providing personalized care when a patient goes through our program here at Skyridge. The bariatric surgery team here at Skyridge are very special. Some of the nurses and the employees here at Skyridge have undergone the surgery themselves, so they know what it's like for you to undergo surgery and to recover from the operation. So they have a personal vested interest in your safe outcomes here at Skyridge Medical Center. One event I'm proud to participate in is our annual gala we have for the patients and the family members. It's called Pants Across Skyridge, and it's a celebration night where we celebrate with the family and the patients involved, where they will essentially show off their new life transformations. And one powerful visual is there is a display where we show people the before and after pictures, as well as the pants that the patient wore before and the new pants that they're wearing now. And I think that's a very powerful visual statement on what this surgery does. And also, it's a very heartfelt evening where you have tears in your eye because of the tremendous transformation that these patients have experienced. I am here to make sure the patient undergoes a safe journey before, during, and after surgery.